AM 1220 KHTS. Carl Goldman with you. We are doing a special 1 hour on our own kind of makeover, the KHTS makeover with Dr. Justin Heller, Heller Plastic Surgery. A number of people calling in wanting to know the website, hellerplasticsurgery.com. People came in from the street wanting business cards, but we disappointed them. It's the phone number 661-434-0092. Dr. Heller has his offices right next door to City Hall here in Valencia, here in Santa Clarita. We were talking and teasing going into the break here about the Brazilian butt lift. What is a Brazilian butt lift?
So the Brazilian butt lift really comes from revolution in plastic surgery, and that revolution was realizing that we could take fat cells and move them from one area of the body to another. Now, we'd always done different types of transfers. We'd take skin and move it to another area and done that. But to really figure out and hone how to remove fat from one area and keep it alive and make sure that it could then augment other areas has really revolutionized plastic surgery over the last 5 years. And that's where the Brazilian butt lift comes in. We've now realized that we can take the fat that's extra from the belly, from the flank, from the arms, from the back, from the thighs, the knees, wherever there's extra fat.
In my case, the neck.
And the neck, of course, as well. We can take it from those areas. And using a specialized technique with specialized cannulas, we can basically take microscopic units of fat and then re-inject them where we need them. And that's the Brazilian butt lift. What we do is we create the form. We can create the shape, the hips. We can define the upper buttocks. We can define the lower buttocks. We can thin the thighs. We can make that whole back section look rear. And a lot of women really, as they get older or just from a genetic standpoint never had it, they can develop the shape and the curves that they were looking for.
And then what you're really talking about is fat grafting, right? Is that the process, or is that something different?
That's exactly what it is. It's fat grafting into the buttocks creates the Brazilian butt lift. Now, the Brazilian butt lift, what it really does, though, is you're taking fat from all these other areas. So you're really doing a full body transformation when you do that. So besides getting a much sexier rear end, you're also creating a much sexier shape everywhere. So that's why that procedure has grown tremendously in my practice, and I'm seeing a lot of women come in who want essentially that. Now, of course, the limitation of that procedure is you have to have fat to donate. So if you're overly thin, overly in shape, that may not be the procedure for you.
I haven't seen any women or men here in Santa Clarita that don't have some fat to give up.
Well, I'm certainly amongst that crowd as well.
I'm sure there are some, though. Dr. Heller, as we've been talking today, you've been saying how changes in the industry in your profession have really occurred in the last 5 years. What was that magic thing? What changed that caused all these shifts in your practice?
Well, the change in the last 5 years has been a growing acceptance of these techniques and the honing of the techniques. In my mind, as a plastic surgeon or any surgeon, you never want to be the first one to do anything because you want to make sure it's tried and true. You want to make sure the results are predictable, and you want to make sure that you can deliver aesthetics. So you have happy patients and likewise a happy doctor. So that's really what it took. It took that to be honed and watching the results develop and seeing that these fat grafts not only change the shape of it, but they also improve the skin. Now there's cells in fat that are like stem cells essentially. And in fact, I actually did research on what's called adipose-derived stem cells. But essentially these cells can also improve the skin contour. In fact, what I noticed when I was doing craniofacial surgery is if we took those fat cells and we put them into radiated fields, which means patients that had burned skin, it would actually make that skin look normal. So carrying that over into aesthetics, it really creates a nicer appearance of skin and can help reverse some of those signs of aging.
Let me repeat that. So you're taking burn victims, for instance, and now able to change their skin back to normal?
Well, radiation is like a burn. So essentially, yes. So essentially, we're taking damaged tissue and it's converting it to a much better state, a much more normal elasticity, much more normal contour, much better appearance.
What's the difference between fat grafting or the Brazilian butt lift and liposuction?
So fat grafting and liposuction. So liposuction usually deals with the removal of fat, does not involve the replacement of it in another location. So what we tend to do is we harvest that fat differently. While we do perform the removal of fat, it's brought in by smaller cannulas, smaller technique, micro dissection basically, and that gets us more in terms of viable fat. Now we can do lipocontouring with that, and we can actually hone that technique and create abs. We can give areas of elevation, areas of depression. A lot of men come in, and women likewise, and they want to get a defined six-pack. Well, that's where that comes into play, because now we can take microscopic deposits, we can leave them behind in areas we want, and then take them out in the areas we don't, and even use them in other areas. So it gives us this large amount of options that we can do now for patients.
Yeah, I'm the guy with the 2-pack, not the 6-pack here. So liposuction, is that still popular?
Liposuction is extremely popular, but the way I like to say it now, because of the differences that I do, is it's more of a liposculpture, which means that you not only are removing fat, but you're leaving it in the areas that it needs to be. And that's really the key, because the way I do it, it's not just one suction and remove and it's done. It's more about actually suctioning areas, leaving microdeposits, leaving a continuous layer of smooth cells behind, so that those cells left can actually help improve the skin, as we discussed, and create a nice smooth contour. Okay, not everybody's a candidate for liposuction, but those that are do tremendously well with this. The way I describe it is, if you think of a balloon and it's fully inflated, you can deflate it a little bit and the skin still looks great. But if you overly deflate it, the balloon would look wrinkly. So somebody who already has wrinkly skin and doesn't have good contour probably wouldn't be the best for a liposuction procedure. But somebody who has good skin, this is an ideal procedure for them.
What are the options for someone who isn't a candidate for liposuction? What are the other choices? So
it depends on where the excess is. But if you have excess skin and it's redundant, it's usually from like a large weight change, whether it be pregnancy or dieting and exercise. If you have extra skin, the real key is to get rid of the extra skin. And there's a lot of different ways we can do that. In the belly, it's called a tummy tuck. In the thighs, it's called a thigh lift. In the buttocks, it's called a gluteal lift, which is a butt lift essentially. So we can remove the extra skin and we can conceal scars. We can do mini tummy tucks. There's all sorts of options, but it depends on how much extra there is.
Yeah, I like calling it the Brazilian butt lift, though. Maybe we can create a Santa Clarita butt lift here and do something very creative. Carl Goldman, KHTS Radio, talking with Dr. Justin Heller, Heller Plastic Surgery. Website, check it out. It's really an incredible website at hellerplasticsurgery.com, hellerplasticsurgery.com. Dr. Heller is here local in Santa Clarita, lives here, family here, and his practice is here right on Valencia Boulevard next door to City Hall. When we come back, we're going to find out more about, and one of the interesting things I learned about Dr. Heller when I was doing my research is he's also a very, very prominent hand surgeon, and I want to talk about that when we return on AM 1220 KHTS. AM 1220 KHTS. Carl Goldman with you. It's a special show with Dr. Justin Heller of Heller Plastic Surgery, hellerplasticsurgery.com, plastic and reconstructive surgery. This has been a real education for me. We were, during the commercial break, we were talking about some of the celebrities out there, and we had mentioned this earlier, that have had the facelift from hell, I'll call it, where they basically look like a caricature of themselves. You were saying, Dr. Heller, that some of that's the New York look, where they want that pushed back look.
Yeah, sometimes they describe what's called the New York facelift, and I hate to generalize it because I really don't think that's what most people are looking for, even in New York. But it's essentially what that ends up being is the skin is overly pulled tight, and they just don't address the layer below it the way they should. So while I'm sure a number of surgeons out there, and in fact some of my colleagues that I know are doing lifts similar to mine now, I think over the past several years that's been the change. So previously a lot of New Yorkers wanted actually to look like they were operated upon, and I think now it's all about looking youthful, making yourself look younger, make yourself look 10 to 15 years younger, but you don't want anyone to know, and why should you?
Well, I think one of the worst caricatures out there, the worst examples of a facelift is one of my favorite country singers who lives on the West Coast, not the East Coast. And as we were talking about him off air, I asked, well, he's got to know he doesn't look good, so why not fix it? And your response was?
Well, usually it depends on how tight the skin was pulled the first time. It's always harder to fix a result that is done not to an aesthetic standard, essentially. So when you're trying to fix something like that, you really need to, if the skin's overly pulled tight, then you're going to have to wait for that to settle. And that could take years before you have a relaxed enough skin that you really can readjust and relift and make it look relaxed again.
And when you say years, it could be what?
5-10 years.
Wow.
Yeah.
So that's it.
So it's really about getting it done right the first time. And that goes for any surgery that you're doing. So that goes back to what I was telling you. A number of people that I see have just, and it's of no fault of their own, but patients will go to people they think are aesthetic surgeons or plastic surgeons, and in truth, they've done a weekend course or they have only done a year-long fellowship, and they really haven't done the training that's necessary to do these procedures.
Yeah, so it's really doing your research, doing homework, looking at up and really getting a good understanding of who's going to do the procedure. Don't just rely on Yelp for your. It's one thing to rely on Yelp for your Mexican dinner tonight, but don't rely on it for your facelift.
Yeah, what I always tell people is know your doctor, know that he's board certified, know he's trained in the area that you want him trained in. Make sure that he has hospital privileges. That's a big deal because hospitals actually will look into the records of their doctors and make sure if they don't have hospital privileges, that's kind of a flag as well. So those are things that are just general things that can be looked at, and they can be done pretty quickly. You can go to the site, the American Board of Plastic Surgery. You can look up your doctor's name and make sure that he's on there and is board certified as well.
And in your case, which hospitals are you attached to?
I'm attached to several major hospitals in the area, including Henry Mayo in this area. Holy Cross are probably the two closest, but I have over 5 hospitals that I have privileges at.
Throughout the Southern California region,
correct, yes.
Which is terrific. We're talking with Dr. Justin Heller here on AM 1220 KHTS. We were talking about a variety of lifts before, and one of the ones we didn't really cover is the arm lift. What's that about?
So a number of women, when they or men for that matter, as they go through weight changes, will essentially have a lot of extra skin in that area. Okay, so when we talk about arm lift, it goes through a spectrum. The first spectrum is the skin good, and all you need is a little bit of fat gone, and if you do, that's great. Then we can just do that with the liposculpture, like we discussed earlier. A little bit of liposuction, making sure to contour areas, and making sure that they look aesthetically pleasing, and let the skin tighten on its own. When we have extra skin, then we start with the minimal removal, and sometimes we can completely hide the incision, or sometimes we need a little bit bigger of an excision of skin to get the arm looking tight, make it look youthful, and get rid of those flappy arms that some people have. So that's where the arm lift comes in, and it's kind of a spectrum that we get as we get extra skin. We can see it in the belly, we can see it in the arms, we can see it in the thighs. It happens in a number of different areas, and we can address those areas by lifting up the skin and tightening them to make it look the way it used to.
There are other kinds of lifts as well then. So you've got the body lift, the arm lift, the thigh lift, right?
That's correct.
And what's the difference with the thigh lift? A difference in the procedure? I mean, obviously, of the thigh and the arm.
Well, the way we do the thigh lift is it all depends on how much skin. So we always try to completely hide the incisions in natural creases so that you don't see them. We try to minimize those and then recreate the contour. Really what we're looking at as on a thigh lift is the inner area of the thigh. We're trying to create that gap that women have. Some women have the thighs rub a little too much. We can just reduce that with liposuction if the skin's good. But if they have extra skin and they're getting a lot of the lumpy, bumpy cellulite appearance, that's where we get into more of the thigh lift, which will really create the smooth contour of the thigh. So all of these lifts, they have one common goal, and it's to create very smooth contour with minimal excisions, minimal scarring.
A little while ago, you mentioned you were involved in the first face transplant.
That's correct.
What's the story behind that?
So the story on this patient was actually he was painting a church at the time. He went up into a high voltage power line and essentially lost all of the skin and soft tissue of the face. Came into Parkland Hospital, which is where I was training at the time, and we underwent a 36-hour procedure to save his life, where we took multiple muscles from one part of the body and moved them onto the face. He then went out to Harvard and underwent a face transplant in that location after the life-saving procedures that were done at Parkland Hospital.
Pretty amazing. How long ago was that?
That was about, now I got to think back, about 7 years ago now that we did that, and it was an amazing case. He's an amazing individual as well. Truly one of the best saves in plastic surgery, and it was just phenomenal to be part of the whole sequence of his care.
That had to be one of your most challenging procedures.
It certainly was. It certainly was. And I'm able to talk about it now because he is public and out there.
What other challenging, without naming names, what other challenging procedures have you experienced, and what would you say are the most challenging for you?
Well, the most challenging procedures always come more from the realm of like a reconstructive procedure. What I always tell people is the beauty of the plastic surgery training is it teaches you the art of making something from nothing. And if you're able to do that, then aesthetics comes very naturally from there. They flow together very well. So the more challenging procedures are, I've had patients who've lost their whole nose or whole forehead, and we've had to reconstruct that. We've had to reconstruct and rebuild entire ears, rebuild the whole jaw using basically bones from the leg and moving those as well. So there's a number of procedures that we encounter, particularly with the microsurgical fellowship that I did, that really would be a full reconstruction of a body part, essentially.
So I imagine a part of your practice, aside from seeing patients, as we've been talking about all hour, where people are coming in for reconstructive surgery or plastic surgery for their own aesthetic purposes, you're probably dealing with a lot of victims of car crashes and other people that are in the emergency room where you're stepping in and assisting.
So usually what I'm sent is, at this point, is more I used to do a lot of that, and essentially at this point what I get sent is all the extremely complex cases after they've usually failed some other surgical procedure that need a higher level of care. So whether it's aesthetic or reconstructive, that's usually what I'm seeing in my practice. So a lot of the aesthetic cases that I see oftentimes are after their first augmentation went awry and certain surgical errors were made. It's trying to fix that and trying to improve upon that.
We only have a couple minutes left, and I wanted to just touch upon an area that's totally separate from your main practice, and that's you're an expert in hand surgery.
That's correct.
How did that happen, and
So-
what does that cover?
So well, if you ask my wife, she'll always tell you that I just couldn't make up my mind because I loved all of surgery. So I ended up doing so many fellowships that one of them happened to be in orthopedic and upper extremity. And the reason I really wanted to do that fellowship was because I wanted to understand how the bones worked and how to adjust those bones, whether it's in craniofacial surgery where we can actually cut and move mandibles around, move the facial bones and skeleton to make children as well as adults look better. And then also when it comes to the hand, where it's involving arthritis and very detailed, fine, intricate surgery. What most people don't understand is our hands are probably the most intricate network of tendons, nerves, and blood vessels in the entire body. There's the most number of bones in one small area. There's the most number of tendons in one small area, most number of muscles in one small area. So to make that work and make it functional really intrigued me. So when I did hand surgery, that's really where the impetus was.
Dr. Justin Heller is who we're talking with here on AM 1220 KHTS. HellerPlasticSurgery.com. HellerPlasticSurgery.com. Practices right here in Valencia, right next to City Hall. Phone number 661-434-0092. It's been a pleasure having you part of this for the past hour, and I'd love to have you back again. talk about more.
That'd be wonderful. Thank you for having me.
We can name all of our celebrities who need to get a makeover. And then we learned, of course, about the Santa Clarita butt lift that we're going to need to work on as well. Justin, you're going to work on that? Come up with a title? So how much time do we have before our break? We're good. AM 1220, KHTS, your hometown station.